you just about to start Invisalign and wondering what the process is like? Hey guys, it's Dr. Nate here at Thrive Dental and Orthodontics, and I'm going to talk to you about the 10 most important things you should know before getting your Invisalign treatment. All right, number one, is there going to be pain associated with Invisalign? So whenever you're moving teeth around, whether it's Invisalign or braces, there's going to be a slight discomfort. And this is why I tell the patients, it's going to be slightly uncomfortable, but if you need to, you can take Advil or Tylenol or any kind of over-the-counter medication to help you out through this process. I would say 90% of the patients do not actually use any type of pain medication, but if you feel discomfort is too much for you, you can. We never prescribe anything stronger than just over-the-counter medication, so that's all you're going to need. Number two, how often should you wear these aligners to get the most predictable results? Invisalign recommends that you wear your aligners at least 22 hours a day. So I think if you're wearing it anywhere from maybe 19 to 22 hours a day, you're gonna get a great result. How do you keep your aligners clean? Well, similar to retainers, you can brush these things in warm, soapy water. So keep in mind, you're only gonna have these aligners for roughly a week or so they're not gonna get as gross as your retainers will be that you have for years and years and years. But warm, soapy water really is all you need. There's also these little tablets that you can add, such as Retainer Bright or other tablets that are similar that can clean off some of the gunk that's a little bit more latched on. What are the attachments and how do they work? Attachments are something that we put on most patients for the duration of their treatment. These attachments help the teeth latch onto the tray better so that they can do larger movements with the trays. And these attachments are all removed at the end of treatment. What's the process of bonding these attachments to your teeth? I have a video that shows exactly what it's like, but it's the same process as putting braces or any other material that would glue on your teeth. There's etch and a bond, and the glue or the composite that we put on your teeth. Very simple process, no needles, no drilling. All we do is you put the glue on the trays and then in your mouth and cure that, and it's as easy as that. What is IPR and is it needed with Invisalign? IPR stands for interproximal reduction, or slimming in between the teeth. Not every patient is going to need this, but sometimes it's needed to reduce black or dark triangles between the teeth, or if the teeth are too crowded, it is needed to make space so the teeth can all fit in naturally. A lot of orthodontists will use IPR instead of extracting teeth. So you just got Invisalign. Will your speech be affected? Anytime you put something new in your mouth or in between the teeth, your speech will be affected. Most patients take a day or two to get used to the trays. I know personally it took me like a day-ish or so to get used to them, and then your speech pretty much goes back to normal. What type of beverages are best for aligners? Anytime you're gonna have a colored or fruity or sugary beverage, you definitely need to take out your aligners. The only beverage I recommend if you're gonna have aligners on is water. Other than that, wines, beers, sodas, anything sugary or stainy, take those trays off, drink your beverage, clean the trays, clean your teeth, and then put them back in. So you have your aligners, and what if you drop them on the floor and there's a bunch of aligners there and you can't really tell which is which? Have no fear, each aligner has your patient number on it, and it also has the number of aligner it is. So there's no way to really mix up which aligner you think you may have, because they're all clearly marked on the aligners. And remember, you cannot mix up the top and the bottom, you just cannot fit it in. So if you ever drop it and there's a bunch of different aligners there, just take that aligner, look on it, you can see some small little numbers on there, and that will indicate the tray number and also your patient number, just in case there's also somebody else's Invisalign trays there, which probably shouldn't happen too much. So what happens at the end of Invisalign treatment? At the end of Invisalign treatment, just like at the end of braces, you are gonna get retainers to keep those teeth looking nice and pretty. And remember, those retainers are a lifelong commitment. For the first 3 months, you're gonna wear it basically 24/7, wearing them just at night after those 3 months. You're gonna wear them every single night for about 2 years, and then you transition to wearing your retainers, once or twice a week, but you do that for the rest of your life. You wanna ensure that these teeth stay nice and straight forever, ever, and that is why retainer wear is so important. So there you have it. Those are the 10 things you should know before you start Invisalign. Remember, Invisalign is an amazing process, very, very painless, minus some minor tooth aches as your teeth are moving, but this is gonna get you that beautiful smile that you deserve. So it's Dr. Nate here at Thrive Dental and Orthodontics, and if you have any questions or comments, please leave them below. You know I'm trying to do my best to answer them as best as possible. And if you have any value in this video, please subscribe, and I will see you guys in the next video.